Then we ask you, Stephen. I mean, do you think that we're going to find a magical recipe to change the way we treat risky patients with thin phenotypes and do things differently?
Yeah, it's soft tissues, hard tissues. So
yeah.
But I think if we think about where we are going, and I'm just looking from my own personal experience. I've been placing implants now for 30 years, so I'm pretty old now, Will, and I've gone through all the cycles, you know, from guides to freehand to navigational surgery to guided surgery. You know, we've tried everything. But what I found is, as I'm getting a little bit older and maybe a little bit wiser, I want to reduce the risks. And there is no doubt that moving into the area of digitization, and Kyle, you hit the nail on the head. You are forced to think about what you're doing and plan ahead when you're looking at planning software. There's no choice. You have to. And you're also then making the most use of all the digital information you have from your CBCT scans to your optical scans and so on. So you're forced into this. And so for me, the implant surgery is becoming more enjoyable because it's taking out a lot of those risks, and you know where you're going ahead of time. And I think the next stage of this must be in being able to reconstruct our virtual patient that we're going to be working on next week, and actually being able to rehearse with augmented reality, rehearse the procedures and throw into that contingency. So Kyle, you said, oh, you're a bit close to the nerve. So what if we get too close? What contingencies can we build into this? And we can take those appropriate steps. It's a little bit like flight simulation and being able to put in some of the different scenarios. And Will, this could be a terrific teaching tool for our residents, who you might say, okay, well, you treat this patient now in the AR world without a guide. You freehand this now, as if you were opening up a flap, and feel how it feels to do it this way, as opposed to going down using, you know, fully guided surgery. So I think that's the most exciting part about the prospects for the future with AI and with AR, for education and also for practicing dentists.